Leigh, patient assessment, take one.
Hi, I'm Leigh. I'm going to be doing your assessment today. Can you tell me your age?
27.
You're 27, and how much do you weigh?
170.
170, and how tall are you?
5'7".
Okay. I'm going to start by doing your vital signs. We're going to do these on both arms. Under your tongue firm. Okay. You can close your mouth. Maybe 7'7". Radial pulse is 7 beats per minute. BP on the left is 146/93. (131/84) on the left. We'll review these after the end of the exam because they do have a difference in pulse pressure. Alright, so I'm going to take a look at your skin. So skin appears normal in color for ethnicity. The patient has good skin turgor, moisture, so he appears warm, dry. I don't see any lesions on the skin at this point. Let's go ahead and have a seat for me. Bring it opens up. Okay, so I'm going to inspect the scalp. Just gonna look at your head here. Do you have any tenderness?
Nope.
So shape of the head is normal cephalic. Again, I'm not seeing any lesions. The skin is warm and dry. I'm going to take a look at his face. So we're going to look at the sinuses. I'm just going to touch back. Is there any pain when I tap on your sinuses here? Sorry. No?
Nope.
Okay, great. I'm going to have you close your eyes and open them for me. Great. And I'm going to have you wrinkle your brows for me. So you're going to wrinkle them up like this. Okay. Okay, so cranial nerve number 7 is intact. I'm going to go ahead and feel your temporal artery here. So pulse is regular and strong. And I'm going to go ahead and feel your TMJ joint. So open your mouth for me and close it. Any pain at all when you open and close?
No.
Do you feel any popping or clicking?
Sometimes.
Okay. Great. And we did this, the sinuses as well. So that completes the head and face. I'm going to go ahead and have you cover one eye. Great. And I'm going to actually put my fingers. Can you see my fingers?
Yes.
How many fingers am I holding up?
2.
Okay. How about over here?
1.
Okay. Go ahead and cover your other eye. And how many fingers?
3.
Okay.
1.
Great. So the cranial nerve number 2 is intact. Now I'm going to go ahead and have you close your eyes for me and open them. So pupils are pearl. Again, I'm going to have you cover one eye. And tell me when you can see my fingers wiggling.
I can see it.
Okay.
I can see it.
Other eye for me. Tell me
I can see it.
Okay.
Yeah.
And how many fingers?
Looks like 2.
Great. Okay, perfect. So you have the extraocular muscles and nerves are intact at this point. And then I'm going to have you follow my fingers here. Good. Good. Very good. Okay, so like I said, pupils are pearl. I'm going to take a look at his eyes. I'm going to have you look up for me. Great. So the conjunctiva is pink. The sclera appears clear. You do have pearl, like I said, and the cranial nerves are intact. I'm going to go ahead and take a look at his external ear. And can you turn your head that way for me? Great. Do you have any pain in your ears at all?
Nope.
Okay. That way. Okay, perfect. Do you have any tenderness?
Nope.
Okay. And then I'm going to go ahead. Can you hear this equally?
Yes.
Okay. So, the cranial nerve number 8 is intact, and now I'm going to go ahead and look at the nose. I don't see any drainage from the nose. Go ahead and cover one nostril for me. Yeah, there you go, and kind of exhale. Okay, and then other one. Good. Do you have any problems with that?
Nope.
Good. Perfect. Let's take a look at the mouth and throat. So open your mouth for me. Great. So the buccal side looks pink. I don't see any lesions in the skin. Go ahead and show me a big smile. Very good. Teeth and gums look healthy. I'm going to go ahead and have you stick out your tongue for me. Good. And wiggle it from one side to the other. To the other. Very good. So cranial nerve number 11 is intact. I'm going to go have you sit up for me, and I need a glass of water for the next test. You don't have to follow me. I don't see any signs of a goiter. The parathyroid gland appears to be intact. Okay, so now I'm going to take a look at the neck. So the trachea is midline, and again I checked the thyroid gland. I'm going to go ahead. That's here. The cervical lymph nodes don't appear to be enlarged. Thyroid gland is intact. I see symmetry. I don't see any lumps or pulsations. I'm going to go ahead and have you sit back for me. So I'm not seeing any JVD with the patient at a 45-degree angle. Patient has strong regular carotid pulses. I'm not feeling any bruit when I'm palpating there. And then I'm going to have you sit up for me again. I'm going to have you take your neck and bring your chin forward and inside and inside. Any pain or tenderness when you do this? Okay, great. So the patient has normal range of motion. And then I'm going to have you forward. And then keep it control. Good. So normal strength as well. Now we're going to go ahead and move to the chest. So So I'm going to have you take a deep breath for me. So the patient has normal chest expansion. I'm going to go ahead. Sorry, I'm going to lift your shirt up just a little bit. So I'm seeing normal skin characteristics. I don't see any lesions. And then I'm going to go ahead and palpate here. So I'm not feeling any tactile fremitus. And no lumps or tenderness as well. Okay, so we're going to go ahead and percuss here. It's probably a little bit easier to see. And we can do it over the shirt. Okay, I'm not hearing any abnormalities when I percuss the anterior chest. Take a deep breath for me. And out. Can you open your mouth when you do that? And out. Good. Deep breath for me. One more time. Good. And deep breath. Okay, so lung sounds are clear and equal bilateral. I'm going to have you stand up for me and then turn your back that way so I can look at the posterior chest. Okay, so again, I looked at symmetry before. I'm going to go ahead and lift the shirt up. So again, I'm not seeing any skin lesions or problems with the skin. I already checked for symmetric expansion on the anterior chest. And again, I'm not feeling any tactile fremitus. I don't see any lumps or tenderness. I'm going to go ahead and palpate over the spinous process. Any tenderness here? Okay. Perfect. And then I'm going to go ahead and percuss again. We're going to go ahead and take lung sounds. Deep breath for me. Big breath. Good. Big breath. Good. Deep breath. Deep breath. Good, so some lung sounds are clear and equal bilateral. Okay, so we're going to check for CVA tenderness. So you're going to feel my kind of tap here. Any pain at all?
Nope. So
So the patient's negative for CVA tenderness. We checked breath sounds. So now we're going to go ahead and have the patient sit back again. And you can flip around for me. Okay. So apical pulse is strong and regular. I'm hearing the normal love down sounds of S1, S2, and the apical rate is about 70 beats per minute. Okay, we're gonna go ahead and we just did that. Okay. Now we're gonna go ahead and check the upper extremity. So I'm gonna have you sit for me. I'm going to have you take your upper arms, and I'm going to take your arms like this. Good. And don't let me press down on your hands. Good. Don't let me push up. Very good. So normal strength. Go ahead and straighten your arms. And then very good. Any pain at all?
Nope.
No. Very good. So normal range of motion. I'm going to check for extratrochlear nodes. So the extratrochlear nodes don't feel enlarged on the right and left arm. I've already looked for distension or the presence of JVD when the patient was supine. I'm going to go ahead and have you flip around for me again. So again, I'm going to examine the abdomen. Do you have a scar here?
Birthmark?
That's a birthmark, okay. So the skin looks normal. I'm going to go ahead and assess vowel sounds. So the patient has normal vowel sounds, and we're going to go ahead and check for vascular sounds. So we're going to check down the aorta. Okay. The patient has normal vascular sounds coming down the aorta to the renal vessels. And we're going to go ahead and percuss the chest, or the abdomen. Good. Sorry, can you take a deep breath for me? So I'm not feeling the border of the liver. Again, deep breath for me. Here I can feel the borderline of the spleen. Okay, we're going to go ahead and do light and deep palpation. So you're going to feel my hands here. Okay, a little deeper. Any pain at all when I'm palpating?
Nope.
Okay, perfect. So we're going to go ahead and do the femoral pulses. Patient has strong femoral pulses, and they also have inguinal nodes, which I'm not going to assess in this video. We're going to go ahead and do the lower extremities. So I'm going to go ahead and assess pulses at this point. So are you able to, I need you on your stomach.
Okay.
Yeah. And then this flat. So the patient has good popliteal pulses. They're strong, regular. And then are you able to take off your shoes for me?
Socks?
Flip right on your stomach for me. Pulses are normal. So the patient has strong equal pedal pulses. I'm not seeing any edema in the lower extremities, so I'm going to have you stand up for me. See, good capillary fill in the toes. Okay, so I'm gonna actually so you're gonna feel my hands here. Does it feel equal on both sides when I'm touching?
Yes.
Okay, how about here?
Yep.
Very good. And how about here?
Yeah.
Okay, and how about here?
Yep.
And here as well.
Yes.
Very good. So it looks like the neuro's intact. I'm going to have you check for some common objects here. Close your eyes for me. Okay, I'm going to put a common object on in your hand. Can you identify what it is?
A pen.
Okay, and then this one.
Sunglasses.
Very good. Okay. So stretanosis is normal, and then I'm going to have you do me a favor. You can open your eyes for me, and I'm going to have you take one finger. I'm going to bring it to my finger, and then to your nose, and then finger, nose, finger, nose. Very good. And then the other hand, finger, nose, finger, nose, finger, nose. Very good. Okay. And then I'm going to have you sit back for me. And you're going to flip around that way. So head here. There you go. So what I'm going to have you do is you're going to you're going to bend your knee, and you're going to bring it to your shin, and you're going to bring it down your shin towards your foot. And then back up, and down your shin. Very good. And then you can switch legs. Good. Down your shin, and back up. And down to your shin. Very good. So normal heel to shin test. Now we're going to check deep reflexes, so you can sit up for me. Okay. So we can do the normal. You're going to feel that you can just kind of relax. There you go. Okay. And now we're going to do the biceps. So just relax your arm. Good. Very good. Okay, so normal deep tongue reflexes. I'm going to have you flip your feet around. And you can lay back for me. So the patient has a normal Babinski reflex, and you can stand up for me. Great. So I'm going to have you walk that way, heel to toe for me. So heel to toe. So come back. You're going to walk heel to toe.
Oh, that.
Yeah.
Okay.
Nice.
Got you.
So the patient has a steady gait as well. So I'm going to have you walk on your tiptoes back there. Great. And you can turn around and you're going to walk on your heels. There you go. Very good. And then I'm going to have you stand with your eyes closed and tilt your head back. Good. The patient has a negative Romberg test. I'm going to have you bend your knees. Very good. You can straighten and bend over and touch your toes. Very good. Normal range of motion. I'm going to have you go from side to side, back, and front. Very good. Normal range of motion to the patient. So go ahead and have a seat for me again. So this obviously isn't a full comprehensive exam. I'm going to recommend that you follow up with your primary care physician. All information. I just want to recheck your blood pressure because you had differences in pulse pressures. So just try to relax. Perfect. Okay, so reassessment of the blood pressure. The blood pressure is equal to the left. All right, thank you.
Oh, you're welcome.
Appreciate it.